I strongly believe it will never replace the other factors. I think that what we have also learned from all these studies is that the clinical pathological factors still have value, bring value. And our US colleagues are currently trying to integrate everything in a model so that the oncologist could just, enter the clinical characteristics of the tumor, the pathological characteristics, and then the genomic signature result. And then the computer program would say, this patient has this benefit from chemo. You see? So it will remain there. In the US, where they tend to order the genomic signatures for everybody, they will be helped by these models. In other regions of the world, I don't think we can pay for the genomic signatures in everybody. And so I think in our countries here, to me, the process of first looking whether the patient is or not at high clinical risk is the first thing you do. If you conclude that it's a low clinical risk, you do not order the genomic test. If it's a high clinical risk, up to 3 positive nodes, then it's valuable to have the information of the gene expression signature.